Hello, everyone. Hello, everyone. We're going to be getting started. Welcome to the webinar. This webinar is on the Global Financing Facility Investors Group meeting briefing. And we are just waiting for people to sign in. So the line will be silent for a few moments, and then we will be getting started. If you are a panelist, could you please make sure that you put yourself on mute, because otherwise we will hear your background noise. Thank you. So we'll be starting in a few minutes. Hello, everyone. This is Christine So. I'm the Executive Director of the Global Health Council. We are happy to welcome you to today's webinar that we are hosting with PMNCH. And the intention of today's webinar is to talk about the upcoming Investors Group meeting to the Global Financing Facility that will be held in Geneva next week, and to provide country updates about GFF progress. We will be joined by Joanne Carter from Results and Mesfin Teklu from World Vision, who are the civil society representatives to the GFF Investors Group. And so we will be hearing from them, and we will have an opportunity for questions and answers. Just for those of you who are new to our webinar platform, just to ask you to please send in any comments or questions you may have by using the chat box that is part of the webinar platform. If you send in your comments and questions, we can then read them out to all of the participants and have them answered by our speakers. You can always email Liz Olway from GHC if you have a problem as well, but please primarily try to use the chat box function. So with that, I am going to ask Drew to take and present us with an overview of the upcoming IG meeting. Joanne, over to you.
Hi, can you hear me? Hi, Christine, can you hear me?
Yes, we can hear you.
Okay, great. So I'll do like an initial kind of overview of the upcoming IG meeting, and then I think Mesvin Teklu, who's joining later, will give a more of a portfolio update. So the next Global Financing Facility Investors Group meeting will be taking place on the evening of June 23rd and the full day on June 24th in Geneva. And the Investors Group meeting will, maybe what I'll do is I'll just run through quickly the elements of the agenda, and then we can come back to sort of some of the key issues around those agenda items. So as with most of the Investors Group meetings, it will start with a kind of portfolio update, so just an update around where the Global Financing Facility process is in the 12 countries that are the forefront runner, and then the 8 second wave countries. There will be a particular focus on DRC in terms of discussion, so a sort of more in-depth update on that. There will be a focus on financing, kind of complementary financing for the GFF. So that will be, it seems like, a discussion with input from a number of the GFF donor partners, speaking about sort of their engagement and their experience of aligning funding with GFF funding. There will be a focus on a kind of results framework for the GFF, like indicators and tracking of that. There will be a discussion around the GFF's role in commodities for RMNCAH, and if kind of exploring a role for the GFF in the sort of global public goods of ensuring access to commodities. And there will be a discussion around governance and the GFF, and that specifically will also include consultations and sort of the role of sort of how consultations are held and how GFF documents are shared with partners. So that does have certainly some relevance for civil society. In terms of the I'll flag a few issues, and then maybe I'll look to you, Christine, if we want to stop and take some questions there. Around the portfolio update, some things that I think are probably important to flag around that. One is that overall there's tended to be probably less information than we would want around the country platforms, and sort of the not a kind of regular systematic update around the engagement in the country platforms and how inclusive that's been, and we know that that's been a important issue for civil society. So we will certainly raise that and ask for kind of more of a comprehensive feedback around that, or on how it's going, where it seems to be going well. If from the GFF Secretariat side there have been particularly kind of good examples or challenges faced. And I think just to say to folks on this call, I think it would be very useful to have feedback from civil society about the experiences with those country platforms, so that the folks that are in the meeting, that we're able to feed that back to the larger investors group, both what's working but also what could be done better, and where the country platform structure really still may not be working to be ongoingly engaging and inclusive of civil society and other partners. I think another thing was flagged in a few other places, but does come up when you look at the portfolio update, is that in a number of countries, the investment cases, the sort of plans that are part of the GFF, are still in development, but in a number of cases the financing arrangements, so with the World Bank's IDA funding and complementary funding from the GFF Trust Fund, some of those have already moved forward. So I think it's a question of not so much that we would necessarily have wanted to hold up funding for these things, but how do you reconcile the investment case and the funding agreement that's already gone forward? Like, how do we ensure that, if we're working together to develop a quality investment case, that fully informs and shapes the way that the funding agreement and the plan would move forward. And then just one other issue I would raise, we knew, I think, just a reminder with the GFF that there are sort of two tools being developed by countries with support from partners. One is the investment case, and the second is a health financing strategy. And in many cases, that second plan, the health financing strategy, is lagging behind, is moving more slowly than the investment case. And I think it's those haven't necessarily been as well developed overall, and also it's been identified that there's just less technical capacity to support that. So I think, again, us as civil society and technical partners thinking through how to ensure that there is the capacity for countries to be able to address this, because obviously it's really important for implementation and long-term sustainability. In terms of, again, just that there will be a specific focus from the government of DRC about progress there. So again, any feedback that partners have about how it is going. I know some folks are working on gathering some information about what is or isn't working around the country platform in DRC would just be helpful to be able to feed into this process. And one other thing that I want to mention that we've talked about a lot, and that's been certainly a focus of really smart input and shaping by civil society, is the country, the country guidance around, particularly around the country platforms that serve as sort of the mechanism to gather together folks in the country to develop the investment case and the health financing strategy and oversee those. So anyway, a quick reminder for folks that may be new to this call. This idea of a country platform and a certain set of minimum standards was a part of the original business plan for the Global Financing Facility, but civil society felt, many partners felt like that wasn't fully developed, and it was necessary to both flesh out those minimum standards and also build upon them and sort of add to them and enhance them. So there was some really smart work done by a number of partners that then fed into a civil society meeting in November, and the development then of a more robust set of minimum standards that were recommended by civil society, but again, not for civil society, but for all partners in terms of engagement in the GFF country platform. That was presented to the investors group in February. We were given time to present that to the investors group. There was interest in that. There was no negative pushback. There was, I think, a good positive response, and there was agreement that that would be incorporated into the guidance going to countries. So just a kind of quick update on that. That country guidance hasn't moved forward yet, but in conversations with the bank, we'll be actually developing guidance for the country platforms that probably will be developed. I don't know the exact sort of date to be completed, but will be developed further over this month of June, and then should be hopefully finalized this summer. And then with the intent of including key elements of the minimum standards, and we're committed to working with the bank to kind of ensure that that's incorporated as effectively as possible. But that's the latest update I have on that. And then just quickly, a couple of other points. So there was a paper going forward around sort of a results framework for the GFF, again, with the intent to build on the global strategy framework. So there have been a set of indicators defined as sort of impact indicators, as well as kind of more sort of process or sort of delivery indicators, and then also indicators around the health financing strategy. So I think overall the goal is to sort of align those sort of with country processes, not create a whole separate process for countries, but integrate that with the global strategy and with country processes and help build countries' capacity on this. Probably a few things to flag related to the results framework. One, I think there is an acknowledgement, I think that many would agree, that the sort of indicators around adolescent health aren't as well developed as in some other cases, so I think there's still room to, certainly there's still room to feed into all of this, but I think particularly in that area there was an acknowledgement of more work to be done. There is equity. The sort of principle of equity is a really cross-cutting principle in all the GFF documents, but and the GFF is not alone in this, but there really is less, at this point there's not really a kind of necessarily clear strategy for operationalizing that kind of equity agenda. There's certainly recommendations sort of in the context of universal health coverage to disaggregate data by wealth quintile, but there isn't necessarily exactly a plan on how the equity would be operationalized, and that's certainly been flagged as an important piece by a number of different partners, civil society, but also a number of governments as well. I'm just trying to think if there's anything else on the results framework. We can come back to that if folks have more questions about the results framework. Then there was a task team that came together around the issue of the GFF and its role, particularly in the sort of issue of global public goods related to access to commodities for RM and CAH. And the task team was kind of tasked with sort of doing analysis of sort of what's the sort of current existing mechanisms on this and the potential role for GFF in some of these particularly sort of more global processes around commodities. And the investors group will be asked, I think in a broad way, to give some feedback on the potential role for the GFF around the sort of in the sort of global public goods for commodities, and also whether this task team should move forward. So a couple of things. One is sort of on a process level. I think if that task team goes forward, at this point there wasn't, I think, a civil society or a private sector representative on that. But I think if it goes forward, it would be good to make sure that that those folks are included there. And then, again, I think the question was a broad one to the investors group about the engagement around commodities, of the GFF. And I think to be determined that role. I think some of the potential areas for GFF engagement suggested were coordination of partners on procurement, financing, and the kind of quality of data, regulatory capacity strengthening, market shaping, and then also leveraging private sector capacity to address supply chain bottlenecks. But again, I think there will be just the guidance, I think, going forward will be fairly broad, and my guess is that they may ask the task team to continue, and I think we can work to make sure that we do find a sort of civil society rep as well as probably a private sector rep to engage on that. So maybe Kadi or others, or Christine, is there a piece I'm missing around the upcoming IG meeting or anything that you guys would add?
Joanne, maybe you could just say a few words about how GFF is looking at humanitarian and fragile settings, and will that be talked about in the meeting?
We might want to wait. I think we might just want to wait for Mesfin on that. He was actually part of that group and has been doing the follow-up. So I would say, I know he's going to join probably in about 10 minutes. I think he was had another meeting that he couldn't shift. He can probably answer that one. Yeah. Maybe the one other thing I would say is there will be some discussion around kind of governance, and one of the pieces is around access to documents. And I think the kind of case that we have made is that it's really, we understand that the documents that are made available to the investors group in advance of these meetings are often kind of internal discussion documents. They're drafts. They're not final documents, so that there's, it makes sense to not necessarily post those widely kind of publicly as sort of draft discussion documents, but the importance of us being able to share those with partners that are have particular expertise or are really committed to providing explicit feedback on these documents. And from my own experience of the board of the Global Fund to Fight AIDS, TB, and Malaria, that's actually worked quite well, and it's kind of how we have been operating, and I think what we would be pushing for, and what was agreed to essentially in the last investors group meeting. So maybe I'll stop there unless, again, Kadi or Mati, who I know have also been tracking these documents, would want to give feedback on anything that I may not have raised.
Thanks very much, Joanne. Yes, since Mesfin hasn't joined us yet, maybe I could go over to Kadi if we can hear her. We always have a few technical challenges when we do this. And hear from her about any PMNCH updates before we go forward. The other thing is, I'll just remind everyone, if you have any questions or comments about what you've heard from Joanne so far, please send them in to us, because we have time right now to take a few questions and have a little bit of discussion. And then once Mesfin joins, we will hear the country updates. So Kadi oh yes, I see you on. Kadi, do you want to speak now? Let's see. Kadi, can you try speaking? I can see that you have signed in now. Kadi, I think you're speaking, but your sound quality is very, very poor. We can't understand you. Yes, it is not. Kadi's is not working. Sorry about that, everybody. Let's see. Joanne, could I ask you to mute yourself, please? Let's see if that helps us any. Thank you. So I am going to ask Kadi if you could hang up and call back in. And Mati, do you want to add anything from PMNCH?
Hello?
Hi, we can hear you.
Yes, hi. Hi, everyone. I think Joanne has covered much about this, but I would be happy to answer any questions, if there are any.
Heidi, I think that we may be able to hear you again. Can you try?
Hello?
Yes, that's better.
Can you hear me?
We can hear you, but you may have to yell. You're still quite quiet.
Okay, well, if my tea hasn't already started, or my
No, we still, I'm sorry, I can just barely hear your voice. And Mati, can I ask you to mute yourself?
Sure. Maybe what I can add in terms of communication from PMNCH side is that we're trying to develop the toolkit for civil society engagement with the help of PAI. So this should be ready quite soon. And we'll be happy to share this with the wider group through the different networks. And besides the communication, there's also a newsletter that we have been sharing with different partners. So it would be great to receive feedback about this new newsletter if you can type any information, and we'll get back to you. Thank you.
Yes, I know, but the other Robert is not here, so who are you calling?
Great. Well, we seem to have a couple of questions.
Yes,
So let me go ahead and ask them to Joanne. The first question is, let's see, and I can hear someone speaking. I'm not sure who that is.
Yes, I forgot my wallet.
Someone who forgot their wallet. I can hear you speaking.
I want to charge. I want to charge.
Can you please put yourself on mute?
And I wanted to give offering, and I put my hand in my wallet, and my wallet is not there. So,
sir, could you please mute yourself? I'm not sure who that is, but Kadi, that may be you, someone where you are.
No.
Let's see, I've got, no, it's not you.
I'm in my office.
Oh, and now we can hear you.
Oh, you can hear me. Oh, well,
Yes.
excellent. Good.
Okay.
No, Joanne, I was just going to say that I think you had a very comprehensive overview of the issues being discussed at the IG meeting, and glad Mati was able to give an overview.
Okay, well, we thank you, Kadi, and I'm so glad we can hear you. We do have a couple of questions. So one of them is, I'm curious if folks outside of the reproductive health community are concerned about the GFF's role in funding commodities. And the second is there anything more specific that will be debated regarding commodities? We've heard that the GFF is looking for countries themselves to come out strongly requesting them in investment cases. So two questions very targeted to the commodity issue. Joanne, could you speak to that?
Yeah, and I'd also welcome Kadi if you have anything to say about this, because I know you've been reviewing this paper in particular, and and having some discussions within PMNCH. But I also think it's actually the first question is really a question to the sort of community that's on this line and others. It would be very useful to get folks' feedback around. Like, we know it's an important subject, but feedback around where we either think the GFF can play a really important role, or again, where we would be, are there places where we would have concerns about the GFF's role and want to manage that. So I don't mean to sort of put the question, answer a question with a question, but I do think that is really important feedback to get, and if there are particulars with expertise in this area that I think would want to individually review that paper, then they could probably be in touch with you or be in touch with Mesfin and myself directly, and I think we would welcome additional feedback in that area. But Kadi, I don't know if you have anything you want to share around this.
I do. So we just read the document this morning, and I think that it's non-committal in the fact that it doesn't sort of outline a proposed role for the global financing facility, and does recognize that there are a number of things that are being undertaken by partners in this space, and that for the global financing facility to have a value add, it would need to identify spaces at the global level where it can sort of increase coordination. I think some of the issues that they have raised that are quite interesting and that might provide some food for thought for the people on the call are around more adequate exploration of the possible role of the private sector in commodity security. There is some reflection on for instance, the what would you call it, coordination of different partners in terms of getting to a space where they all have the same information on procurement, financing, and quality, which would facilitate getting access to these drugs and commodities in countries. There are questions around whether regulatory capacity strengthening is something that this group might support, given that this is something that's relatively high cost if done country per country, or whether there's a role for market shaping in terms of getting a consortium together that might be able to influence pricing of medicine and equipment. I think I would find I would join Joanne in saying that there aren't sort of many thoughts expressed in the paper as to what they think the GFF is well placed or not well placed to do. So it would be useful to hear from this community about what what their thinking is.
And one other.
Oh, thank you. I want to just read another question that we've got and comment. We have had particular concerns around CSO engagement throughout all stages of the development of the investment case. In particular in Uganda, in the final costing of the investment case at the moment. You mentioned the importance of health systems tools. What opportunities can you identify for CSOs to be involved in the development of the health system strengthening paper? Joanne, over to you.
Yeah, I mean, so I think so there's a couple of things. One, at the sort of at the global level and at the level of the investors group meeting, I think it's, I just want to reiterate, I think it's really important for us to get this kind of specific feedback and even, you know, more details from the person sending the message about what have been the challenges of engagement in the country platform. Because I know in some cases people have been engaged in a kind of consultation, but then there's been no real structure for follow-up and engagement. And then, you know, the other point I had raised and relates to health systems, but also to health financing. I think that there are roles that civil society can really smartly play in this, and I don't necessarily think we're being engaged either for input or even for kind of technical support in some of these areas. So I think one piece is explicit feedback to us to bring to the investors group about challenges that are still going on, and I know that there is a set of tools being developed by PMNCH and other partners to support engagement, but I also feel like if civil society folks feel like there are roles and important engagement that should be happening at country level that isn't, and that's country specific, I think one other role we can play is to feed that back to the Secretariat, you know, in some ways to feed that back to the country level to say, you know, to explore that further. So I don't know, Christine or Kadi or Madi, if you have additional suggestions, but I think it's the degree to which we can share that information more broadly and make sure these things are working, but also share the information in country-specific ways that can, you know, feed back to the country teams to help ensure that there is smarter, more inclusive engagement, and then using the tools that we've got.
Yep, I think if I may, part of the responsibility lies with the GFF and writ large, so Secretariat and in-country partners. But I think that part of that responsibility, part partially also lies with the civil society organization, and it becomes a question, particularly given the speed at which the investment cases are being developed and the content being put out in terms of identifying what partners are actually able to do in countries. So I think from our end, we are trying to get information to the different partners because we understand that there has been a lack of just useful information on who to contact and how to get engaged in the processes. But I wonder how we can come to a space where we become better organized, all of the people that have interests in getting engaged in these processes in countries to see how we can start some discussion about making that happen. And I know the Civil Society Coordinating Group goes some way in trying to do that, but it would be useful for us to think through how, as civil society, we do that more broadly.
Thank you, Kadi and Joanne for those responses. And we also got another comment and question from Liberia, which I'm going to read. I think you've already answered it to some extent, but it is around health system strengthening again. So our participant writes, I am joining from Liberia. I am new to this forum, especially given the learned lessons from the Ebola epidemic. Investments can be volatile if any investment isn't accounting sufficiently for health system strengthening around RMNCAH. My question is, what is the role of system strengthening in the GFF approach? I think you all have already spoken to this, and we've been hearing about, for example, building capacity around commodities and around results and these things which actually do feed into health system strengthening. But feel free to respond again to this particular question if you have more that you'd like to add. We have another comment which is going back to the question of commodities. The question is, on the topic of commodities, have there been any considerations of how the World Bank and governments will ensure the quality of commodities procured through the GFF? I know this has been a particular concern to the reproductive health and family planning community, and so I would welcome you to speak to any issues around quality that may be being discussed or that may have been raised. So Joanne, over to you.
Well, so two things. I mean, on the health systems piece, I completely agree, and I think the GFF has made the case that this needs to be a sort of comprehensive response. It's sort of building on the health system and building in those pieces, and that includes the health financing strategy. And in fact, a number of us have made the point that we need to track both the sort of investment and planning around explicit RMNCAH and the broader health systems, that it's really important to ensure those health systems pieces are there, and it's also really important to ensure a really explicit, smart focus on enhancing the sort of coverage and access and quality of RMNCAH and nutrition investments. So sort of both. I think we can't forget the health systems, and we also need to make sure that in some cases the planning or the systems aren't so broad that we're not also focusing on the real opportunities there are in RMNCAH, built on a platform of a quality health system. So I think we need both, and we need to be able to sort of track and report on both. Again, the paper's pretty broad. I would just say, but I think the sort of issue of tracking quality and tracking data on quality was one of the areas raised in there. But again, I think we would welcome more feedback about roles that you think the GFF could play on this. And again, if there are specific folks that have expertise on this and want to review this particular draft paper, we can also share that.
Thank you. Kadi, do you have anything you'd like to add?
Just Christine.
Oh, Mesfin, you're here.
This is Mesfin. Maybe if I may on what Joanne was saying on the health system strengthening. Sorry for joining late. I was on another call. So I think the GFF also has developed what's called a result framework. I think that's what, which includes indicators, and the indicators are around the health financing, as well as programmatic level, impact level indicators, programmatic level, coverage types of indicators, as well as health system related indicators. So these are picked from the WHO core 100 core indicators, looking at a number of health system related indicators. So it's really this list of indicators are a resource for countries, but certainly the GFF has prioritized few indicators that they would like to monitor across countries through investment case. So I think there is an intention as well as a process for ensuring inclusion of key health system building blocks are actually being included in the investment case. But again, the quality of the investment case is also dependent on how much is being built based on good analysis. And I think the quality assurance mechanism is one process to highlight some of these issues. So just what I want to say that this result framework is one tool that is available for partners when the investment case are actually being shared to look at with this lens to ensure that health system issues, coverage related indicators, as well as impact and financing related indicators are actually adequately addressed. Thank you.
Mesfin, thank you for that, and we're glad that you've been able to join us. Why don't we go back to you right now and hear from you around the country updates that you were going to provide, and also if you could speak just for a moment about the question of fragile and humanitarian settings, because we know that you've been working on that as well. So please, over to you. And again, everyone who's participating in the webinar, please go ahead, and if you have questions for Mesfin as he's speaking, please send them along to us, and we will try and take some questions at the very end of his presentation.
Okay, thanks, Christine. So just for do you have my slide on the webinar, or I?
We do.
Okay, okay, great. So it was coming slowly from.
We'll just advance it as you speak.
Okay, great. Thanks, Christine. Hi, everyone again, and I'm Mesfin Chaklu, one of the civil society representative in the GFF Investors Group. So a few updates from me in terms of progress since the last, the second IG meeting in February. And a number of the things that I'm talking are related to country-specific information, and as well as some of the work that's happening globally. I think we have already, in the previous discussion, talked a number of issues related to commodities, and as well as a number of paper that is going to be discussed at the next investors group meeting. But just to confirm that the investors group has a new interim chair since Dan Jacovella, who was representing Canadian government, moved on to new role, and the GFF investor group appointed Chris Elias of the Gate Foundation to be the interim chair, and he is leading the investors group, and there has been since the last meeting a consultation on result measurement. I think this is building on the work that's being done by WHO on the core indicators for the global strategy. So based on those indicators, I think the GFF doesn't want to build a separate indicator track, which is separate from the global strategy. So the plan is actually to ensure that the GFF result measurement is embedded within the global strategy indicator monitoring framework. So that work has been going on, and I think there is a paper written related to result measurement, and it addresses financing, programming related issues, health system issues, as well as CRVS. So that will be in the agenda for the next GFF meeting. And then there is a commodity task team that has been put together and led by Jennifer Adams of USAID. I think Kadi already talked about the paper, and which will be in the agenda for the investors group meeting next week. And that is one product that's being developed through a task team. And another information for you is that the investors group asked the private sector constituency to develop a private sector engagement framework that was presented in the last IG meeting, and with a couple of comments from the investors group, it has been finalized and adopted. So that framework is a public document that can be shared if you haven't seen it before. The other work is the GFF role in fragile and humanitarian context. This was a paper that was developed at the instruction of the investors group. It was presented in the second IG meeting in February, and the IG recommended to the task team that the GFF role in fragile and humanitarian context need to be weighed in carefully, because I think there is the humanitarian context is quite different from perhaps maybe the kind of situation we are looking at through GFF, which is using national system and through investment framework, health financing strategy, which is quite different process than humanitarian response. So there was a feeling or even a recommendation from the investors group that GFF might not be the appropriate vehicle for humanitarian response, but rather ask the task team to clarify the GFF role in fragile context. So out of the 12 countries, some of them who are already working with GFF have some context that's considered as fragile. I think they picked specifically Liberia and DRC, and then asked the task team to document the learning, how the GFF process so far being used in those contexts to address issues of equity, issues of access, issues of system fragility, and then provide a recommendation for the November IG meeting. So that work is going on, and there is a terms of reference written, and the Secretariat will be commissioning a work to review the process that's happening in DRC and Liberia to understand how the GFA process is enabling to address RMNCH in fragile context. The other thing is there has been a consultation on the role of GFF and adolescents, and I think this is practically, the challenge in terms of lack of evidence-based programming for addressing adolescent issues, and I think to clarify what are the activities or projects that GFF could fund related to adolescent issues. So that consultation was held at the back of the Women Deliver meeting, and there is a follow-up work that will be developed with the Secretariat, and I think there will be more work on adolescent. I think there isn't as such a clear recommendation in terms of what GFF can fund related to adolescents. So there, I would expect that there will be a guidance that would come out of that to help countries in their inclusion for investment case. But so far, Liberia actually has clearly articulated to address issues of adolescent and youth in their investment case. I think there is some work there, but I think more need to be done to ensure that GFF is relevant to adolescents. And there is a new website that was launched that will provide update about the Global Financing Facility. You can see the web link, and it has basic information so far, but I think the vision is to put all the GFF-related documents, including investment case, on this platform so that partner will be able to access. So that's what's being promised by the Secretariat. Next slide. I will go through quickly on the countries updates so far, and this is based on the information that was compiled by the Secretariat. So I'm just paraphrasing and summarizing from the Secretariat report. So to start with Cameroon, there is a full draft of investment case expected by mid-July for Cameroon. I think the GFA process in Cameroon has been quite fast, and I think it has engaged quite a number of partners. We are told that nearly 200 civil society even participated in the process. So any of you who are in this call who have first-hand experience, I think it would be great to hear how the experience of civil society engagement in Cameroon. And the World Bank or IDA and trust fund financing, it's nearly 100 million IDA and 27 million trust fund has been approved by the executive directors of World Bank to finance the investment case. But one thing to note here is that you may ask that why how come the finance is being approved before the investment case is finalized? I think this is some of the challenge I think countries and even we are observing because the IDA project approval has its own cycle and it is get approved during the board meeting basically, and I think their IDA envelope is determined based on a number of parameters. I think the whole idea of GFF is that to leverage this IDA money to ensure that certain proportion of this IDA money goes to RMNCH. So the total amount is for IDA is approved. This is not all, perhaps maybe for health in my understanding, but there will be a negotiation with the government and the bank how much they can leverage using the trust fund to allocate an IDA for RMNCH. Or this could be, the IDA portion which is allocated to RMNCH. I think that might need a bit of clarification. But Cameroon is going forward with their investment case and soon to be finalized. That's my understanding. Next slide. Of course, there is other partners also discussing on the complementary financing for the investment case. On DRC, the latest information we have is that investment case to be finalized by 15 June, which means this week. And there is IDA and trust fund which has been approved in March. I think this is mainly for CRVS, both coming from IDA as well as trust fund. And there is additional financing expected in 2017. But I think there is quite already existing collaboration with pool funding in DRC with a number of donors, and the GFF is aiming actually to leverage that, finding a complementary financing from all the partners to ensure the full investment case is financed, so including IDA plus other donors' money. Next slide. I think the next one is Ethiopia. For the Ethiopia investment case, Ethiopia is using what's considered a health sector transformation plan as investment by itself. But I think World Bank partners who have been involved, they would like to see more sharpened, RMNC plan within the HSTP. But I think, they expect nearly 50 to 60 million IDA funding for Ethiopia, perhaps which would be approved in the second half of 2017, which is an additional IDA funding. So there will be quite significant resource going from the World Bank to finance the investment case. And then USAID is also so far providing a trust fund for to support health financing, nearly 10 million, which is another resource available in terms of building their health financing strategy related to community-based health insurance and social health insurance, which is a basic foundation for the health financing in Ethiopia. Ethiopia has already what they call it performance pool fund that bring together a number of partners' resource, and there is a plan to expand that pool fund by bringing from other partners. So be an increased resource available to fully finance the investment case, which is basically health sector transformation plan for the next 5 years. Next one. The next country is Kenya. As you know, Kenya is one of the front-runner country, and in fact, it's a country which finalized the national investment framework and approved quite early. And so far, I think this investment framework is being sent to county level to help them to develop their county-specific plans. So that's where it stays now. But I think it's not quite clear how the county plan is going to be finalized and approved. And there is a lot of need for technical assistance identified. So far, there is already a multi-donor trust fund for technical assistance established between DFID and USAID. This is basically to provide technical assistance to the 20 priority counties and the national government, which is quite good resource given that the process is quite decentralized and counties are expected to come up with their own plan. And the other thing is the trust fund is also providing a resource to hire a GFF country focal point. I think that's also good to improve coordination between the Ministry of Health as well as the Office of the President and the partners. So that's another progress since the investment case approved. I think it's expected that by June this month, an approval of trust fund financing of 150 million IDA and 40 million trust fund. So quite substantial for the investment case. And again, a number of partners, especially donors, are in discussion, and there is a commitment from Denmark, Japan, UK, and US to align their country assistance toward the investment case, which is what GFF is aiming to do in terms of complementary financing. Next slide. Liberia, I think Liberia is also one of the countries that started late, but I think it's moving a little bit fast as well. Investment case has already been drafted and shared for consultation, and there is quite a strong emphasis actually on the Liberia investment case to look at health system issues, emergency preparedness. I think the Ebola experience must have informed the investment case. There is a strong focus on adolescent and youth issues. So, that's one good example how the different population groups are being considered in the investment case. So there is an expectation of IDA and of nearly 60 million for the investment case, and a number of partners including Gavi and Global Fund also again in discussion in terms of complementary financing to the investment case. So these are what we have heard so far about Liberia. The next one, Mozambique. Mozambique is quite early in the process, and it's just starting actually the investment case. And we are informed that there is a World Bank and partners scoping mission happening this weekend last week, and the purpose of that mission is to discuss and agree on time frame for the completion of investment case and health financing strategy. Again, Mozambique has also the same experience of pool funding. Health financing strategy has been in the making for the last 2 years, so there is already a momentum building toward that, and the GFF is aiming to use the existing process and platform. And again, Mozambique is just starting, so this is what we know so far. Next one. And the other, Tanzania, as you know, Tanzania is one of the early starters as well, alongside Kenya, Ethiopia, and DRC. And Tanzania is using what's called One Plan 2 as investment case. It's just like the National Health Strategy for other countries, which has been used for Tanzania for years. And that is the one which has been used as investment case. And in terms of financing, actually Tanzania is one of the countries that received funding early in 2015, which includes, nearly 200 million IDA and trust fund. There is also the certain amount of money from the Power of Nutrition Trust Fund, which I don't actually remember the actual figure. It's also significant going towards the investment case. So I think it is at the stage of implementation in terms of Tanzania. Health financing strategies in Parliament, and a number of partners is also looking at supporting the health sector strategy for where this investment case is sit, and that is basically to look at complementary financing to ensure that good coordination among health financiers in Tanzania. Next one. Uganda, I think there was a question before as well about Uganda. I think the investment case, as we know, it's been near final, but I think we also learned that there is quite a lot of challenge in terms of finalizing the investment case. The GFF vision of serving as a platform for coordination has not yet lived to its expectations. So there is quite mismatch between the costing aspect of work being done as part of the investment case and financing strategy and the resources available to finance investment case. So in a way that I think there is a challenge in terms of coordination. That's what we were told, and I'm not sure how soon the investment case actually get to completion unless those issues are being sorted out. But again, Uganda is also using their existing, what they call in sharper RMNCH plan, basically to using GFA process to look at the service across continuum of care. And in terms of funding, IDA available for Uganda is 110 million, and then of course matched by trust fund grant, and it's expected that the board to approve in 2016. Again, this is the money available, and the final investment case certainly would decide how much of those money would be distributed among areas of intervention. And other partners are also looking at the investment case in terms of alignment and the health financing strategy, which has also been in the making for many years before even the GFF, and this is being approved and finalized by MOH, but I think it requires review and approval by cabinet. So that's where it stands in terms of health financing. Next one. Nigeria. Again, Nigeria is one of the second wave countries, and the process for investment case development in Nigeria was not clear from the beginning, but I think Nigeria has been quite actively engaged with the GFF partners, and at the moment Nigeria has negotiated with World Bank in terms of financing to the northern region, which is basically affected by conflict, and this is approved as an emergency fund to address RMNCH in this 5 conflict-affected northern regions. So, you can see the amount from IDA as well as from the trust fund. But again, in terms of GFF, I think the Minister of Health is yet to lead development of roadmap for the broader GFF process. So that is still in the making while they are implementing GFF finance in the conflict-affected northern region. Next one. Senegal, I think Mati probably would speak better on this one, because I think there has been quite strong engagement from civil society in the process from the initial stakeholder consultation convened by the Ministry of Health, and civil societies are actually have been also organized, and we are quite. This is one good example of a country where the information sharing between country and global level engagement can come together, actually enable your engagement at the country level. So the Ministry of Health has the RMNCH platform which was kind of convened for GFF, and then it's expected to be formally launched in June, I think, which is quite good. And then there is a commitment by the government to appoint a GFF focal point so that people have a point of reference for engagement. And there is a plan to develop the investment case on existing strategy, which includes a range of services across the continuum of care. And the health financing strategy is actually to work on integrating the universal health insurance program, I believe, which is currently under development in Senegal. So quite, a lot of momentum building, and still on the establishing phase. The minister herself is quite committed and engaged with the GFF investor group globally, and so far I think we see that there is quite a good trend happening there in terms of partner engagement. Next one. Bangladesh and India, those are the two countries from the Asia region. Again, like other countries, Bangladesh is also using existing platform or process to develop investment case, and they have experience of working on health sector swap, and that's what's going to be used. And of course, the financing for this ongoing health sector swap, I believe, has been present to the World Bank, but I think it is yet to develop its investment case using the swap process and looking at the service areas across the RMNCH agenda. So that's where it stands for Bangladesh, and I don't have much information to say apart from that. But India is yet to decide how it's going to participate in the GFF, so there isn't much happening in India that's available to share. So I think that's all I have. There is nothing, I don't think there is any more slide left. So thanks very much, and I will stop here. Maybe I will let Joanne, if you have maybe just a comment on any of the points I mentioned or any additional thing that you would like to add, and then maybe we can open it up for discussion. Thank you.
Thank you, Mesfin. Yes, we'll go over to Joanne. I just want to say we actually are over time. We had an hour for this meeting today. We still have many people signed in, so we can definitely hear some words from Joanne and take any additional questions, but we're going to have to end in the next 10 to 15 minutes because we actually have the Francophone GFF webinar coming up at 30 past the hour. So Mesfin, thank you so much for that. And I do just want to raise one question, which I think Joanne referred to earlier, but it would be good to talk about this again, is this question of the availability of documents. We have a participant who has asked for the private sector document. And so Joanne and Mesfin, if perhaps you could let us know if the private sector document is available to share widely, and again, just if you could touch on that question of how documents are being shared out. So that's a question that we have right now. Thank you. Joanne, do you want to comment?
I could start because I want to say again, just to be clear, that the policy that was agreed to, and I think will be discussed again in this next investors group meeting, is that the documents that are provided to the investors group as sort of draft documents for feedback or consideration are not public documents, but that we are able to share those with particular folks who are part of a core group or who have expertise and willingness, based on their knowledge base or based on their role in countries to give us specific feedback on that. So, the guidance is really not to post the sort of draft documents publicly or share those widely because they are draft, but that we do have the ability to share those with partners, which is why I did raise that if partners are interested in seeing particular documents where they would give specific feedback to us that we can bring to the investors group, we can also even share some of those draft documents, but would ask folks not to then post those. and then documents that have been approved, I assume those would be public documents. Mesfin, I don't know what you would say about the private sector document at this point. I think that's a final document.
Yeah, it's a final document. I believe it can be shared.
Yeah, I would think so too. And in fact, I'm not sure if some of those are on the website, but we should probably make sure that in some ways anything that is approved or sort of final document is made public.
Great, thank you, Joanne. And did you have anything else that you wanted to add to what Mesfin said about the countries?
No, I think that was really comprehensive. And that the one thing I said earlier is that I think we're hearing a lot from partners about some places where the country platform is actually working better, where there's a kind of robust engagement, and other places where there's still more of a struggle for folks to even know who to engage with or where. So again, I think just feedback on that is really helpful, and we certainly will raise, I think getting some more comprehensive feedback as part of the regular updates about how that's going to the investors group and more broadly will be really important and useful, but it will certainly be helpful to us, in the next week if we can get feedback from partners about where things are working well and where folks in country or that are working with country partners have suggestions for how it could work better.
Thank you very much. I think that one really recurring theme that we hear through all of this is the need for really robust and transparent communication. And I know this webinar series has been organized very much within that spirit. But at the same time, although there's a global financing facility website now, we're not necessarily seeing the availability of documents as frequently or as comprehensively as we might wish. And so I think that is definitely a message that we will continue conveying to the investors group, to the Secretariat, and that we would encourage all of those interested in working on GFF to convey to their partners. And certainly in terms of the investors group, as Joanne has said, we cannot necessarily share out the documents widely prior to the meeting, but when things are adopted, we will push to make sure that they become available. And we will plan on having a webinar after the investors group meeting during the summer months to update people on progress that came out of that meeting. I think that at this point we're going to have to close out this webinar. We want to thank everyone who has participated, all of you who sent in comments and questions. We want to thank the panelists and especially Joanne and Mesfin for their ongoing interaction with the Secretariat and with the investors group. And we will be providing as many updates as possible through PMNCH, through the Global Health Council, and through the GFF website and our various constituencies as we go forward. So thank you, everybody. Please stay tuned, and as I said, we will be having more of these over the summer months to give you further updates and hear more from you about how this is going in country. So thank you, and have a good rest of your day or evening.
Thanks, Christine. Thanks, everybody.
Bye-bye.